This video will highlight some of the many activities ongoing in the LSU COMD program. With our new generation of researchers, LSU COMD has moved into the realm of high-tech exploration of speech and language. Researchers in our department are asking where in the brain speech and language are processed. We have three researchers conducting EEG testing with children and adults, 2 researchers using MRI scans, electromyography testing of motor neurons. 2 researchers use functional near-infrared spectrography for neuroimaging. 2 researchers are using eye tracking for measuring eye positions and eye movements. 1 researcher is using biofeedback. 2 researchers are conducting transcranial direct current stimulation. And 1 is using high-speed video endoscopy for voice. Students at all levels are involved in this exciting research. We have MA thesis research, class poster session research, doctoral students presenting at national conventions, lab volunteers, especially undergraduates, who volunteer 5 hours a week in faculty research labs, and many of them conduct undergraduate research. Dr. Hyunju Chung talks about this in her lab.
Our lab is LSU Child Speech Lab, and this picture shows inside our sound booth where we test our participants. And I'm Hyunju Chung, and I'm an assistant professor in the Department of Communication Sciences and Disorders, and I'm the director of the lab. Our members include 1 PhD student and 3 undergraduate students who are all working on their own research projects. The main focus of our lab is to examine various speech patterns produced by young children. Especially, we have been comparing semi-vowel sounds produced by young children with and without speech sound disorders. We have also examined speech patterns of adult speakers and how their dialectal or language backgrounds influence their speech using acoustic measures. Recently, we have also started exploring ways to understand speech by utilizing ultrasound imaging data.
We also have an expansive range of clinical opportunities for our students. We are currently working with the schools on a speech sound disorders only early practicum in the speech setting to provide in the school setting to provide our beginning clinicians with an early experience in schools. A few highlights from our clinic include our adult aphasia clinic, where we have a complete ADL suite, where our adults can work on functional communication in realistic settings, and when they are ready, ventures into the community to practice their communication skills. An intensive summer preschool speech and language program where children are immersed in the use of language through learning centers such as literacy, symbolic play, fine and gross motor skill development, art, and a myriad of other experiences and language-rich activities. LSU had the first pediatric feeding clinic in the region developed by Courtney Gonsolin. Through her efforts, the importance of this has spread across the state and region. LSU began teletherapy on a small scale prior to COVID, but like all programs, it became a primary source of service delivery during the pandemic. Knowing teletherapy is here to stay, we provide experiences in this format for our students. Dr. Melda Kundek does clinical work as well as research at Our Lady of the Lake Hospital. Through her and Courtney Gonsolin's efforts, our students take part in the Our Lady of the Lake Cleft Palate team, which has been designated as an official team by the ACPA, American Cleft Palate Association, the first recognized team in Louisiana. We were also designated as an official craniofacial team. Through 2 student tech fee grants, COMD was able to purchase a wide range of state-of-the-art AAC devices that are used in class, for student training, and in clinic. The grant includes provisions to lend the devices to clients in the community. A newly established program is the Multidisciplinary Ochsner Clinic. Our supervisors, Sarah Mealy and Courtney Gosselin, work off-site with our LSU grad students to learn how to perform and interpret swallow studies at the Ochsner site. This new satellite clinic opens wonderful opportunities for students to perform both pediatric and adult swallowing studies. Courtney Gosselin and LSU graduate students met with the Cleft Palate team to talk about this opportunity.
LSU COMD graduate students have an amazing opportunity to participate in the Our Lady of the Lake Children's Hospital Cleft and Craniofacial team, where we provide speech, language, resonance, and feeding evaluations in a multidisciplinary team-based setting.
I'm Dr. Morris, and in our craniofacial team, we provide the services from otolaryngology, facial plastic surgery, craniofacial surgery, neurosurgery, speech-language pathology, pediatric dentistry, orthodontics, audiology, genetics, craniofacial pediatrics, and social work. I'm Dr. Laura Hetzler. Our team has been in existence since 2014. We hold clinics for our children about every 2 weeks, and we love having the LSU COMD students.
And then finally, the stroboscopy clinic. Dr. Kunduk was successful in obtaining a grant to provide stroboscopy equipment for the clinic. Graduate clinicians assess voice and resonance in the strobe clinic on campus. Our clinicians provide assessments for referred patients and volunteers. They learn how to perform and interpret these exams to provide efficient, evidence-based treatment to their current and future clients. We are pleased to introduce Dr. McWhorter from the Our Lady of the Lake LSU Voice Center to talk about our collaborations with their program.
Hi, I'm Dr. Andrew McWhorter. I'm the director of the Our Lady of the Lake LSU Voice Center and a professor in the Department of Otolaryngology, Head and Neck Surgery with LSU Health Sciences Center. And I wanted to take a moment to express how thankful we are for the opportunity to be collaborators with Dr. Kunduk and the LSU Department of Communication Sciences. We have a great team, which is an integral part of what makes our business a unique center across the entire Gulf Coast region. We work with the students as part of their primary training as a site, but also significantly the PhD students who are a major part of our team and part of our research efforts, and they contribute both clinically and through these research activities. And if we have graduated 2 previous students and have 2 current students, and it definitely brings an opportunity for our patients that they wouldn't otherwise have. This collaborative work under Dr. Kunduk, along with our research team, including Dr. Akuma, really is a defining part of our mission of research, teaching, and education. So it's great value to us, and I hope you can see the benefits of that through the publications and the opportunities that are provided to the students and the grad students. Thank you.
Another important collaboration is with the LSU Athletic Department. Clinical faculty Sarah Mealy has been working collaboratively with Ray Castle for several years on dealing with concussion.
Hey, I'm Sarah Grain Mealy. I'm clinical faculty at LSU, and I specialize in adult neurogenics.
Hello, I'm Ray Castle. I'm program director for the Master of Science and Undergraduate Program in Athletic Training. I've been here for 20 years now as a program faculty, clinical professional practice. So I think some of the things we've done already in a couple of years is working with our program in athletic training. We look at it from a standpoint, I've had her come in to speak with our students on traumatic brain injury, looking at the spectrum of healthcare needs and thinking, and really thinking out the box of the traditional. What we think of is that as an athletic trainer, then moving into a physician and mental health specialist, but looking at where the speech pathology and the communication disorders plays a very critical role that people think of in everyday care. So while most of our stuff we deal with is in most of our minor traumatic injuries, there's a potential that goes beyond that. So that's where we've brought in, and we're already talking about doing some other things down the line from an interprofessional standpoint, which will be very beneficial mostly for the patient that we're dealing with, with all respect.
And
What's the IPP potential?
Pardon?
What's the IPP?
That's interprofessional education.
I know. Give us that piece.
I'm sorry, what's that?
He said that's developing here, so can you talk on that a little bit?
How we're collaborating to develop that.
Well, I think that's going to be something time we'll deal. We're working. We've got to work through that. I think one of the things that's new is a statewide collaborative that's being initiated. We'll have a number of different healthcare programs here on campus. We've been bringing stakeholders outside the campus that we can start to develop and learn from each other's their opportunities that they bring to our respective programs and different perspectives. So that's something we've talked about a little bit, but I think we're going to continue to do that. The first step was one, having some, the lecture side as well. I know I've spoken with you all about possibly coming in and doing some work with your looking at different from a patient standpoint, what we do from having an emergency medicine or other, just from general healthcare standpoint, but that's what we'll look at down the line. So we're excited. I know I'm excited about continuing that work as we'll move down the line.
A lot of education to be conducted as far as, especially within this field of concussion, what to look for, what signs and symptoms to report, prolonged signs and symptoms versus just an immediate addressing of the symptoms. So it's just a lot of great information to be able to share and to work off of each other for the athletes across the university.
I think for us in athletic training, we're hitting all patient sectors, not just athletes. So it's really about building this umbrella, and whoever the patient is holding the umbrella, and whoever's there it fits within that. And a lot of different people fit within that who are working to protect the patient and also to make that patient as healthy as can be. So I'll take that approach of a team approach.
One of our collaborations between graduate faculty and students is represented by the LSU Screening Clinic. Here, Dr. Jana Eddings, Supervisor Elena McMurray, and a current student discuss this unique collaboration.
Hi, I'm Juliet DeChera, and I'm going to be talking about the collaborative research done here at LSU. Over the past 30 years, we have been conducting community-based screenings. In 2008, we examined 4-year-olds, and the results indicated 44% screening fail rate in the public settings, whereas the private setting was 15%. In 2015, before I was here, we started a new project that examined all screening data that was collected by our clinic. From 2015 to 2020, we have been using the PLS as our screener, and we have had 50 master student clinicians that have received training for our clinic. Our hearing screenings, our students also received training that included otoscopy, tympanometry, and OAEs. The collaboration has supported 3 LSU Discover posters and 1 ASHA poster. I am currently a senior and will be participating in the LSU Discover Day for 2022. The collaboration has also supported 3 master theses and 2 dissertations.
LSU faculty are actively involved in community engagement. Below is a list of some of our current ongoing activities. Our presentation is far from comprehensive, representing a drop in the bucket of the many activities that are ongoing in COMD, but we hope it gives you an overview of who we are and what we do.